in and she says, you know, I feel like my blood pressure's high. The doctor goes, you know what? Your blood pressure is high. Let's start you on, 5 milligrams a day of metoprolol. Who's here has ever seen an older person on 19 medicines? Shocker, right? Well, we're just going to add this one medicine here, metoprolol, for blood pressure. And this is the dose I usually use in 55-year-old patients, so sure, let's do that on you. Except grandma's kidneys aren't terribly good. Or they were good and now they're not. And so the medication that's supposed to keep your heart rate low and your blood pressure low now keeps grandma with a heart rate of 40 and a blood pressure of 80 over 40, or 70 over 30. You've seen what that kind of blood pressure looks like in anybody, old person or otherwise. Diaphoretic, confused, and laying in bed like this. And the family comes in and goes, oh my God, and they call 911 and you show up, right? And what do? Well, we just started this new medicine, and they proceed to go to the kitchen cabinet. There's 15 medicines, and 4 of them are expired, and the new one that they did use is this metoprolol. Well, this is a nothing dose of metoprolol. That can't possibly be it, right? It's the new thing, though. It's the new medicine that they're on. It's the change in medication. And that's one of the big important things that you all need to realize. Anytime you're getting history on an older patient, anytime you go in, you're trying to figure out what's happening, drugs. Especially new drugs. Those drugs that might have worked when they were 50 don't work anymore, or they almost overwork more now. They're more concentrated in them. They have more powerful effects in them. 2 drugs that are harmless alone may not be harmless when combined. That's the problem. Also, increased adipose tissue. This does not sound terribly fun, right? You get less water and more fat. Who wants to do that? I don't know about you, I'm going to be jogging like every day when I'm an old person. But the issue here is that the increased adipose tissue, all those fat-soluble drugs last longer too. So here's one. Who's ever been to an old person at a nursing home? I used to do this too. Old person in a nursing home is a little bit confused, a little bit agitated, so what do they give you? Anybody ever hear of Ativan? Ativan in old people is a weapon. Remember that. It's like driving drunk. Ativan is a fat-soluble medicine. Old people are full of fat, and they do not respond well to sedatives. And so you give someone Ativan to keep them calm. What happens? They stay super calm. They go into a little mild chemical coma. They've been really sleepy for a day or 2. Meantime, nursing staff either calls you because A, they're really sleepy and haven't woken up in a day or 2, or B, they can't wake them up at all, and that's a problem. Drugs are the most common cause of delirium in old people. The most common thing you are going to get when you get called to an elderly patient's residence is a cough or an altered mental status. Sick person. Not chest pain, not shortness of breath, not abdominal pain, just sick. Think about meds. It's the most important thing in elderly individuals. Any questions so far? Nobody? Okay. You. What's your name? Nice to meet you, Arthur. It's the most common cause of delirium in old people. Dementia is a little bit different from delirium. I mean, like among the causes of being okay, then fine. Okay, then fine. We were just talking about it. I get a ton of them from my doctor. Drugs. Straight drugs? Cocaine? That kind of drugs? Prescribed drugs. That drugs they're supposed to have. How could that possibly go wrong? Everybody overlooks that. Don't. Think about drugs. Any drug. Anything. Look at this list. I'll go through, I'll give you a real life example of every single one of these to prove that I'm not just making this junk up. Sedatives. EDZ is benzodiazepines, Ativan, Valium, muscle relaxants. Grandma fell last week and they gave her some Flexeril to help her with her backache. Anybody ever been on Flexeril? How does Flexeril make you feel if you've never been on Flexeril before?
Loopy.
Anybody ever see that Michael Jackson video with Thriller when they're all like zombies dancing around? That's what people say. I've never been on Flexeril, but I've seen people on it and I've seen people confused on it. Narcotics. Oh my gosh, narcotics. There is nothing worse than a confused old person who people give narcotics and Ativan to calm them down. Lord Almighty. Narcotics get you into a ton of trouble. narcotics in old people, A, last forever. B, are extremely sedating. What happens if you're on a lot of morphine? Anybody ever had morphine for a surgery? Maybe you had an appendix out. Maybe you got really badly injured, had a splinter leg or something. You been on morphine?
Yep.
What's morphine make you feel like?
Well, I kind of passed out when
From the morphine or from the other thing?
I don't really know. I was just kind of out.
Okay. How about you?
How about euphoric?
Euphoric, yeah.